Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. I'm starting a series on psychiatry where I'll make videos on frequently asked questions in university exams. So let's start with the topic mania. First, we'll see the features of mania. Marrow has given a nice mnemonic called dig fast. Okay, D is distractibility, I is impulsivity, G is grandiosity, F is flight of ideas, A for activity means increased psychomotor activity, S is for decreased need for sleep, and T is for talkativeness. So you can learn the features of mania by mnemonic dig fast. Okay. Again, I'll repeat: distractibility, impulsivity, grandiosity, flight of ideas, increased cytomotor activity, decreased need of sleep, and talkativeness. Okay. So out of those symptoms, seven symptoms, if any three features are present and elated mood is present for more than 7 days, we can diagnose it as mania. Or any four features plus irritable mood is present for more than 7 days, we can call it as mania. So to diagnose, we have to get these features. We'll elaborate these features little bit. Okay. So for mood, we have euphoric or elated mood or irritable mood, increased confidence and grandiosity. Okay. So in mood, you can write all these things. Coming to speech and thought, they have pressured speech, flight of ideas, loosening of associations. Okay. Inflated self-esteem and grandiose ideas. When it comes for activity and behavior, they have increased goal directed activity, restlessness, over familiarity, disinhibition, risky behaviors, and reduced sleep without fatigue. So this thing you can elaborate under activity and behavior. Now coming for biological and cognitive things, they have distractibility, poor judgment, lack of insight, appetite is increased or decreased. Okay, so you can elaborate these features of mania. Okay, and learn by the mnemonic dig fast. It is given by Marrow. Coming to management of mania, that is, we'll learn about lithium carbonate. It is a three marker in itself. So lithium carbonate is a gold standard for euphoric mania. Okay, it is also known as mood stabilizer, and mood stabilizer is also known as thymoleptic. Okay, thymoleptic or anti-maniac drugs. Coming to mechanism of lithium carbonate, it modulates monoamine neurotransmitters. Okay, it modulates monoamine neurotransmission that inhibit inositol monophosphate. Okay, so when monoamine neurotransmission is modulated and inositol monophosphate is inhibited, then this secondary messengers are inhibited or reduced, so the neurotransmission is less. Okay, so this stabilize neuronal firing and circadian rhythm. So this is how lithium carbonate works. What are the indications for lithium carbonate? Acute mania, prophylaxis of bipolar disorder, adjunct in recurrent depression. So these three things are the indications. Okay. Acute mania, prophylaxis of bipolar disorders, adjunct in recurrent depression. Contraindications is very important. This lithium carbonate, it is contraindicated in renal disease. It is contraindicated in first trimester in pregnancy and dehydration. Coming to dosage, 600 to 1200 milligram per day is given in divided dosage. What is the therapeutic serum level? Therapeutic serum level in acute mania is around 0.8 to 1.2 milliequivalent per liter. And then we have to go for maintenance dose, that is 0.6 to 1.0 milliequivalent per liter in serum level. Okay, more than 1.5 milliequivalent per liter of serum level is toxic. Okay, so coming to adverse effects of lithium carbonate: hypothyroidism, nephrogenic diabetes insipidus, and tremors. Okay, so when we are giving lithium carbonate, we have to keep on doing monitoring serum lithium levels, check for fasting renal function test and thyroid function test. To get the best results, we have to check while fasting. Okay, this RFT and TFT we have to check while fasting to get the best results. So this was about the mania and lithium carbonate. What is hypomania? Hypomania will have mild symptoms and the duration is more than 4 days. But in mania we have duration more than 7 days and symptoms are moderate to severe. Okay, and in mania we may have psychotic symptoms. Okay, admission may be required in mania, and there is flight of ideas in mania, but in hypomania there is no flight of ideas. Okay, and one more important thing, this hypomania is a bipolar 1 or 2 disorder, but mania is a bipolar 1 disorder. What are the other drugs for mania? In acute mania we'll go for antipsychotics. Okay, then we have valproate, carbamazepine. Okay, so you can use this also in treatment of mania. So this was in short about mania and lithium carbonate. Thank you so much.